Hi, my name's Jordan, 31 years old, and this is the first time I'm visiting a hygienist. I've never been to one before, don't really know what to expect, but let's see what happens. When I went into the reception area, it was nice and clean. They also had a lot of products I could buy if I wanted. I had to fill out this medical form since it's my first time here. I wasn't really sure what information to put or how detailed to be, but I figured the more information they have, the easier it is for them. After the nurse took my form back and put my details on the system, I sat in reception and waited for the hygienist.
Hello, I'm Donna the hygienist.
Hi,
come on
Jordan,
through.
nice to meet you.
How do you
Thank
do?
you.
Do you want to come on through?
Yes, thank you.
Do have a seat.
Cheers. Once I sat down, the nurse and Donna put on their PPE and we went through a few simple questions about my normal routine.
What kind of toothbrush do you use at the moment?
So I use a manual toothbrush. I use one of these small bristles. There's like more bristles to like the toothbrush head. I think it's like a Swedish brand of sorts. I do use a Sensodyne toothpaste because I do have a lot of fill-ins.
Okay, and what about cleaning in between? Do you have a go with anything?
I don't really have a routine.
Right,
I'm a little
okay.
bit embarrassed about that, if I'm being dead honest with you.
That's what we want, a bit of honesty. Most people are like that, really. So do you get any bleeding when you brush your teeth at all?
Not recently, but historically, yes.
Yeah.
So I last went to the dentist in probably late 2021, if I'm being honest with you.
Any other worries or problems that you feel about with your mouth, teeth, gums?
Currently I feel as if a little bit of one of my fillings have kind of might have fallen out.
Right, okay.
There's no pain present or anything like that, but...
It's not sharp or anything on your
No, it's not sharp. It just feels somewhat different.
Okay, right, okay. Joe, could you just pass me the form and then we'll have Thank you. So we'll just check your medical history here. So that's all right. You don't smoke, so that's good. You're not an alcoholic, so that's good as well. Okay, excellent. Everything else seems fine. All right, let's just pop you back a little bit and we'll have a little look. Okay. So if it's all right with you, we'll just have a little look round and see how things are. So all I'm doing is I'm just walking the probe round just to check your gum health. Make sure the probe doesn't disappear. Okay, lower right, 2, 1, 2, 2, upper left, 1, and then 2 on the upper right. Do you want to put, there's a little BOP on the upper right, a little bit of bleeding there, just in between those teeth. Yeah, and on the lower, it's not drastic. I know you're thinking, well, it's bound to bleed and you're sticking a sharp instrument in. Okay, so on the whole, your gum health's pretty good. A little bit of redness, a little bit of bleeding, but I think that's mainly coming from in between the teeth, and that gives us an indication that we need to have a little nag at you about cleaning in between. So I'm going to give them a little clean, if that's okay with you. There's not a lot of deposits, just a few little bits around there. But we're going to go around all the teeth. We're going to use a scale that sprays out a little bit of water. So it's a bit noisy. If it's uncomfortable, just wave your hand and we'll stop. Unfortunately, the water can be a bit cold, but we'll do our best. Joanna will use the aspirator.
I'll try and get as much as I can, all right.
Okay, yeah. a bit noisy, that drives me mad. Let's just have a little check and see how we're doing. So behind these front ones you get a little bit of hard deposit, so when the bacteria grows on your teeth it's soft, and sometimes the mineral salts in your saliva set it hard if you don't manage to brush it all off.
Okay.
And the saliva glands, you see, come into your mouth just here, so that's why you always get that little bit of a build-up on the front teeth. Quite a bit, so we'll give them a little polish, and then I'll chat to you about what I want you to do with your brushing. Alright, we'll just sit up and have a little rinse just to get rid of all the polish. Not to foul. I don't want you to panic, the polish is red as well, so it might look like a bit of blood there.
Yeah, I have a tissue.
How do you feel?
Good.
There you go. Yeah, I'll take this off you.
Yes.
And then you just stay seated.
What we need to do now is just sort of have a chat about brushing your teeth. So on the whole you're not doing a bad job, but you're getting a little bit of bleeding coming from in between your teeth and around the gum margins. So what we just need to do is make sure that when you're brushing, that you're brushing around your gums a little bit better, and maybe start to show you something to clean in between.
She went through and showed me the proper brushing technique. The Oral Health Foundation have a full video on this, which you can click here to watch. Hey, so I've just had my first dental hygienist appointment. I'm booked in for 6 months from now. It went really well. They told me that I look after my teeth very well. I've also got a goodie bag with things like dental floss, Sensodyne toothpaste, and some different toothbrushes to kind of get in between the gaps that I've been missing. It was very informative, and yeah, I'll be coming back again.